So if you have any work from last 9 weeks, say for example, you were quarantined, you just disappeared, whatever your reason was, and you got an F, you need to make sure that you're going into the folder looking to see if you have any work. Because right now in Power School, the grades are locked, so we can't go in and change grades. However, when they give us access for people that have to do like grade recovery and stuff like that, I need y'all to turn y'all stuff in so I can put my grades in. So that applies to you, which you should know if you failed or not for the last 9 weeks. If not, I can tell you. Then you need to make sure that you're getting that done. Because I'm pretty sure it's going to be for like a limited amount of time that they're going to allow us to put grades in. All right, so we're going to continue talking about health careers. We're going to give you something a little bit that we're going to go over. So we're going to talk about introduction to health careers.
You are at a place in your life where you are beginning to consider what type of career you want to pursue. This time can be both exciting and scary. Thinking about the rest of your life at your age can be a little intimidating, and you probably have 1,000 questions. This module will help answer questions you may have about healthcare careers and careers in general. In this lesson, you will define passion, purpose, skill, and talent, identify advantages and disadvantages for a healthcare career, determine workplace facilities for healthcare careers, and identify the 5 healthcare career pathways.
All right, so having the knowing the healthcare career pathway is going to be very important. Well, these are our objectives. We're going to find passion, purpose, skill, and talent. We're going to identify advantages and disadvantages, determine workplace facilities for healthcare careers, and identify the 5 healthcare career pathways.
How do you choose a career? It really depends on what's most important to you. Some ideals you may want to consider before you choose are passion, purpose, skill, and talent. Click each button to view more information.
All right, so we're going to talk about passion first.
Passion is defined as any powerful or compelling emotion or feeling. Passion is what gets you going and what fuels you. If you can find or create a career that supports what you are passionate about, you will enjoy your work.
All right, so write down the definition of passion. What passion is. All right, so passion is any powerful or compelling emotion or feeling. So that's the definition right now. All right, so
Many people
purpose.
search for their purpose
Purpose
in life.
is the way, the
Your
reason you
purpose
exist.
is
So
the
write that
reason you
down.
exist.
The reason you exist.
Finding your purpose in the work you do every day can be extremely fulfilling and can help you understand your role in the grand scheme of life.
All right, I got it. So your purpose is the reason you exist. You might not know what your purpose is now, but hopefully sometime soon you'll figure out what your purpose is. Here, pull your mask up, Cheyenne.
Skill is the ability coming from one's knowledge, practice, and/or aptitude. In other words, if you are skilled at something, you do it well. You can always work to improve your skill level.
All right, so the skill is the ability coming from one's knowledge, practice, and/or aptitude. So I'll write that down. So those are the things that you know that you're skilled in. Things that you know how to do, what you are knowledgeable in, things that you practice doing so that you're knowledgeable in it, and that you can do it well. All right.
Talent is a special natural ability or aptitude.
So write the definition of
What
talent.
talents do you have? Is there already a career field for your talent? If not, could you turn it into a career? choose a career? It really depends on what you do. Some of you this, but information.
All right, so now we're gonna start talking about your healthcare career pathways. So it's divided into hold on a second. It's 5 different ones. Why does it look like that's not done?
How do you choose a career? It really depends on what's most important. May skip Tisha.
All right. So the first one we're gonna talk about is diagnostic services.
In this lesson, you will define the primary role of diagnostic services, identify various skills needed for diagnostic services, and identify various occupations connected to diagnostic services.
So these are our objectives to define the primary role of diagnostic services, identify various skills needed for diagnostic services, identify various occupations connected to diagnostic services.
Explore information about diagnostic services by clicking each of the buttons below. If you've ever had blood drawn, the person who analyzed your blood works in diagnostic services. Workers in the diagnostic services pathway use tests and evaluations to detect, diagnose, and treat diseases, injuries, or other physical conditions at a specific point in time. Choosing a career in this pathway means you will work in a field that is both extremely important to healthcare and one that is rapidly growing. However, if you really like working with patients, you should know that this pathway does not necessarily involve day-to-day direct patient contact. Careers in this role will become proficient in using the latest techniques and diagnostic imaging technology, such as ultrasound, X-ray, and MRI. As technology progresses, diagnosing patients is becoming faster and more accurate than ever before.
Alright, so I'm just checking out a sheet that has the different pathways and the different careers that go under those pathways, so y'all can get a better understanding of like what we're talking about. Alright, so like I said, diagnostic services. As you can see, it is the second like column. Some of these jobs can be both diagnostic or therapeutic. It just depends. Like for respiratory therapists, they both fall under therapeutic and diagnostic. You can do both. Nurses under both. So it just depends. Okay. Which of the following are included in the diagnostic service pathway? Huh? Anything else? That's it.
It's the first one. No. The one I picked first.
What'd you pick?
Diagnosis.
I got diagnosis on there.
I think I'm missing one.
Did you say detective?
He said.
You said detective?
He said that.
said not person.
Run around.
Hold on. Testing and evaluation, prescribing. Alright, so you're gonna test and evaluate to detect, diagnose, and treat diseases, injuries, or other physical conditions. Alright.
Explore information about diagnostic services by clicking each. If you are interested in working in diagnostic services, you need the following skills. You need to know how to prepare by following instructions. You need to know proper procedures in the field. Great planning skills are necessary for this field. You must know how to evaluate information. And your reporting skills need to be awesome.
Alright, so skills needed are preparing, procedure, planning, evaluation, and reporting. Alright.
Many jobs within diagnostic services require a specific education or training, such as an associate's or bachelor of science degree. Most states require passing some type of national certification exam, registration, or licensure by a national professional organization.
Huh? Alright, so requirements needed for diagnostic services, you have associate's or bachelor's degree. This is mine.
We hot too.
And nobody said nothing about being hot, so I turn this fan on.
I'm not hot, I'm cold.
You cold?
That's what that noise is.
What noise? That's outside. Hey, Master. Alright, so passing a national certification exam, registration or licensure by a national professional organization. I forgot to tell y'all. Y'all remember I had to renew my license last week?
Yes, it's strict.
I was stressed. But guess what happened? I got audited. A random selection. So remember I told you I had to do so many like CEUs, 24. Then I could do my little, pay my fee. Which the fee went up, it's $130. But anyway, so pay my little fee and then submit it. Well, a little thing popped up when I hit submit, told me I had to send in all my certificates of my CEU, so I had to print all those out and send them in. Sorry. We did that already.
No, man.
We didn't do that. Oh. What are skills you should have when working in diagnostic services?
I love it. Delegation. What that mean?
Take out delegation. They go observation too.
No, you gotta observe. You gotta observe too.
What are some possible education options for diagnostic services? What?
I heard
A
associates and
certificate.
bachelors.
Bachelor's?
Bachelor's, master's. No, associate.
So you got certification, associate's degree, or bachelor's degree.
Explore information about diagnostic services by clicking each of the buttons below.
All right,
Here
so
are
here
some
are some.
occupations within the diagnostic services pathways. Click each occupation for a short description of the job.
Oh.
An EKG technician attaches electrodes to the chest, arms, and legs of a patient, which trace electrical impulses given by the heart. An EKG tech must know how to handle the EKG machine to get an accurate reading for the physician to review and interpret.
I was not on TikTok.
All right, so echocardiographer. We don't call them echocardiographer. We call them EKG technician. With that, I don't know if anybody ever had an EKG before. Y'all know what it is. You know what it is, man. They put the little electrode. I heard somebody phone that I shouldn't hear. I didn't say.
Oh, you listening?
I said I hear somebody phone that I shouldn't hear. That's all I did. Alright, so they put the little electrodes on the body. So you can put one. Come on. She looking like death today. Not that she looks like death, but like she wants to kill people. So I don't want to. Alright, so what you do, you put electrodes.
Please excuse this announcement. Teachers bus 1880 has just arrived. Allow these students into your class without a pass.
So you'll look at, like, so this is what y'all learn later, your sternum, that's your breastbone. So you'll put, in the numbers are V1, V2, then you go like under the breast, 3, 4, 5, and 6. Left arm, right arm, left leg, right leg. And it's detecting like what your heart is doing. Thank you.
Pardon this interruption for a few morning announcements. Good morning. This Thursday, 9th grade and JV girls, 9th grade boys and JV girls will play host to Lanier here at Jeff Davis basketball at 4 p.m. Please come out and support. Baseball and track trials will continue on today after school at 3 p.m. See Coach Banks or Coach Johnson for baseball questions, or Coach McKnight for any track questions or concerns.
Boy, track.
Students, this will be the last week we will be filling the Jeff Davis City. Please check your student emails by the end of today for the link to place your order. Additionally, students, please be reminded, I know it's getting cool outside, but please make sure you understand that you wear rainbow colored hoodies to school. Any others are subject to be compensated.
I got a gold one.
And will have to be
I don't have
picked up
gold.
by
I
an
said I
adult.
got a gold one. I don't have gold.
Students, when the bell rings, please make sure you move to class as quickly as possible. Make sure you're taking the shortest route to your class and no lollygagging in the hallway. This concludes our morning announcement. Have a great Tuesday.
That's school on lockdown.
Where?
Spring Valley.
Where's that?
I'm with the road.
Also, it's here.
They got a whole elementary school on lockdown. It's closed.
Yeah, parents walk their home and turn.
6 people supposed to be.
At the school?
It's on
Randomly got shot.
Oh wow. Alright, so EKG text. We learn how to make I learned how to do EKG. She called it like 7:30. I know I'm I'm not sure. Alright, so when I work at a hospital, well, it depends on what hospital you work at. Sometimes respiratory therapists that we are trying to do EKGs as well. So at night I would have to do them sometimes. But during the day they have EKG technician that does all the EKGs. But at night I think they used to leave at 11. So from 11 to 7, we would have to do them only if it was like an emergency situation.
Here are some occupations within the diagnostic services pathways. Click each occupation for a short description of the job. Phlebotomists are responsible for collecting blood specimens for laboratory analysis by medical technologists. Precision and accuracy are extremely important for people in this role.
Alright, so phlebotomists are basically those people that take blood. You know, you go to the doctor, you go to the hospital, people come in and take your blood. They're phlebotomists. And usually if they're phlebotomists, they stick people all day long, so they're very, 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 very good. That's one thing that PCT has on it, phlebotomists, so patient care technicians can draw blood as well.
Diagnostic medical sonographers, sometimes called ultrasound technicians, operate equipment directing high-frequency sound waves toward a specific part of the patient's body. The sound waves make echoes, forming an image that is photographed for the physician to analyze and interpret.
Alright, so they have what's called diagnostic medical sonographers, but most people just call them ultrasound techs. So those people that you'll see in the doctor's office that do the ultrasounds on the baby, I mean, you know, when somebody's pregnant, they might do it. You know, you can get ultrasounds on almost anything, but like some people have to have ultrasounds of their heart. So those are the people that do that, because that's clearly a man, huh? That's clearly a man right there. So he might be getting, I don't know what he getting an ultrasound on, but maybe his heart.
Dental laboratory technicians make a variety of restorative dental pieces, such as crowns and dental implants.
So they have something called a dental lab technician, and I'm not sure. I don't know a whole lot about dentistry. I don't know what he's putting on now.
Acrylic.
You gotta have a steady hand for that.
Pathologists specialize in knowing or finding the reason why a person is ill or deceased. Pathologists are medical doctors, and some handle autopsies.
So pathologists are the people that study like reasons why. So when somebody's get killed or somebody dies, they're gonna try to figure out the cause behind it. So you know, sometimes when they have these big old murder crimes and they're trying to figure out, so they'll consult a pathologist to see how long they've been dead. You know, they're looking at different things on the body to see like it was like trauma to the head or a gunshot wound, the ways that it, you know, the bullet exited and all that stuff. So they are doctors, pathologists.
Radiology technicians prepare the patients for the x-rays, operate the equipment, keep patient records, and may even adjust and maintain the machines.
So anytime you get an x-ray, mostly like in hospitals, maybe in some doctor's offices, they have people that are called the radiology technicians, and they're the ones that's going to do the x-rays. So.
MRI technologists specialize in capturing magnetic resonance imaging, which uses magnetic field and radio waves to produce images of the inside of the body.
Has anybody ever had an MRI done before? Nobody?
No.
Those machines are so loud. Like, it's this big old machine right here. It's a big magnet. So anytime we would have to take a patient to MRI, you can't wear your wedding ring, you can't wear your earrings. You gotta take, everything out of your pockets because you're gonna get stuck to this machine. It's a big magnet.
It's scary.
It is scary because people have died. Like, we have, I know y'all seen oxygen tanks before, but that's like metal. So we have to have all kind of special equipment to go in there because we can't take any of that stuff in there.
I feel like you'd be stuck in there.
Some people have died because it's a big magnet in the force. I have to have MRIs like yearly, but mine has to be face down. And just imagine, like, you in this machine, this big old machine, you on this little bitty table, you face down, so I can't see nothing, and it's a whole bunch of noise.
I just
Go to sleep. I need to be awake so I can hear things. What I told y'all about when I'm teaching? Huh? Huh? It's hot. You can go, but that's your reminder. What? What? He is being nosy. I heard him ask, what she say? Alright, so that's what an MRI is. And like, the people don't sit in the room with you. They're in there like they're behind this glass. They can talk to you like a speaker in there. So like, they'll give you this little button. So like, if I feel, because I know a guy that he had like a whole panic attack in there. He was like, yeah, I didn't stay in that whole minute. So, because people don't like to be close. Some people don't like to be closed in. They're like claustrophobic. Yeah. So he said he was like pressing that button. He was like, oh yeah, we're gonna have to do this another day, another day. But they give you a button in case you get, some anxiety going on, so they can come in there, or they can stop the machine. But it's very, very noisy. Like, you have to wear earplugs. It's that loud. And then you have a medical
laboratory
technician.
Technicians perform tasks such as preparing lab specimens, doing manual tests, and operating automated analyzers.
All right, so we're gonna look at therapeutic services now.
In this lesson, you will define the primary role of therapeutic services, identify various skills needed for therapeutic services, and identify various occupations connected to therapeutic services. Explore information about therapeutic services by clicking each of the buttons below. You've most likely met workers in therapeutic services because they work directly with patients in many ways. You've most likely met workers in
All right, so write that definition of therapeutic services.
You said therapeutic services.
Therapeutic services definition. So they work directly with patients to provide care, treatment, counseling, and health education. So these are like your people that, day to day work with patients almost every day. So that's your nurses, that's your doctors, your respiratory therapists, your just a bunch of people that actually work day to day with patients.
I can do that.
Thanksgiving. You cooking in
Hmm?
for Thanksgiving?
Probably.
You know you do.
But I'm saying, like, it depends on where we're going. I don't know where we're going yet.
Oh,
What you mean home?
You staying there? Did you go here or
I might go to my husband. I mean, my husband's house. My mother's house. My mother's house.
what you think?
She stays like 30 minutes from me.
Or go you can
Or we might go to Pensacola. My sister-in-law lives in Pensacola. So I don't know where we're going. It depends, because, you know, I might not have to cook the whole meal, because we usually, everybody brings something.
bring beef to the table.
Beef?
Yep. Mine is.
I think my husband wants like a turkey. And then
Okay, and tell him you gonna burn the beef.
I usually, no. I usually make the peach cobbler and the mac and cheese. Huh?
So you got the cousin you make the most. Because you got the most people.
I know my cousin gonna be there.
So I am sister like not every minute.
I like both my sister-in-law.
You still.
Alright, y'all got it?
No.
I hope y'all write y'all notes.
I ain't writing them type.
Okay, when they done.
I had that in my he be trying.
Well, I don't understand why y'all can't ignore people. Because you all on the thing.
I can have a civilized conversation. I don't know. I did. Right up here wrong.
Alright, y'all done? Is that a yes or no?
He said no.
You gonna be dependent on me. He's so precious. Yeah, he sure you take food. But when we going back?
What's this for, your birthday?
The dinner bell. Everybody
I gotta beat the people.
I have me a vacation for my 18th.
Alright, which of the following are included in the therapeutic services pathway?
Working
Therapy, counseling,
treatment, counseling, that's it.
health education.
Well, that's how you know that. That's it.
I was reading.
Hey, for y'all.
Prescribe it.
For y'all male directors.
Who is third drink? No, I'm not.
Oh, wow.
I get it down. I be
So we got working directly with patients, treatment, counseling, what?
prescribe it. Wait, can y'all prescribe it?
We were shaking our heads.
Yes, that's it.
Huh?
I was talking to Van. That's it?
Yeah.
Explore information about therapeutic services by clicking each of the buttons below.
Alright,
If you are
skills and
interested in working
education.
in therapeutic services, you need the following skills. You need to have great communication skills and enjoy people. You must be able to problem solve based on the patient's needs and diagnosis. You will need continuing education to stay current with the latest therapies. Creativity helps to make treatment plans that are successful for patients. Finally, you must be physically strong and willing to stand for hours.
Alright, skills are communication, problem solving, learning, creativity, and physical strength. These are the things that you should have if you're going to be in the therapeutic service career.
Many jobs within therapeutic services require a specific education or training, such as an associate's or bachelor's of science degree. Most states require passing some type of national certification exam, registration, or licensure by a national professional organization.
All right, education requirements. You have certifications, associate's degree or bachelor's. You got to pass a national certification exam, registration or licensure by a national professional organization. Which of the following are skills you should have when working in therapeutic services?
Great communication.
The what?
No, that again.
Clerical skills, like being a secretary,
Oh, yeah.
like answering phones and stuff like that.
No.
Creativity.
I see.
So you got creativity and great communication
I like
skills.
better when you talk to them.
Huh?
I like better when you talk to them.
Well, I don't really know what they're gonna say sometimes, so it's not words on them.
Master's, bachelor's, and
Certification, bachelor's, what?
Master's.
You sure?
Associate. That's it.
They didn't say master.
Explore information about therapeutic services by clicking each of the
All right,
buttons
so here
below.
are some careers in this field.
Here are some occupations within the therapeutic services pathway. Click on each occupation for a short description of the job. Paramedics are called to emergencies. They make quick assessments of the patient's condition and provide care during transport to a medical facility.
So this is a paramedic. So those are people that will be on the ambulance, that respond to the scene. So you remember we talked about paramedics and EMTs. So they got to be able to be quick on their feet. They got to assess their patient, and then once they get them stable enough, they'll transfer them to the hospital or transport them to the hospital.
Ooh, I remember.
A physical therapy assistant helps patients regain a physical therapy assistant.
That was a pyramid. That was a typo.
Oh yeah, they're sometimes they'll call like ambulance and they'll call the fire truck. Everybody show up, so they gotta be first responders too. Those firefighters.
Because one time I had went on a field trip to Troy. It was a campus tour, and the firefighter was talking to us. Mind you, it was so weird because he was a cute dog. And he started barking at me. I said, "What this man barking for?" And I'm like, "Oh." Cause he just like, he was like, I think he said something like my bro. I think that's what he said.
Oh, he must have saw somebody else that was a cute.
I'm like, why are you barking at us? He wasn't barking at us. He
Yeah.
was barking at somebody behind him. I'm like, we talking about firefighters and you trying to bark.
Assistant helps patients regain physical mobility with methods such as exercise, massage, and electronic stimulation. They may work directly with the patient or handle patient files.
So this is the assistant to the physical therapist. They're just gonna work directly with them. They might do a lot of the things that the physical therapist does, but they're like under the physical therapist. What happened in my class when? What happened in my class yesterday? When? What student? What period? I don't recall anything happening. And me? No.
It was even there yesterday. I knew you had to probably went to the
Cause a lot of people didn't show up yesterday. I just asked you, did it have a problem with me? You said yes. Oh, yeah. What?
An occupational therapist helps patients improve their daily living or job skills. This job varies depending on the client's needs.
Well, he your friend. Oh. Alright, so now you have an occupational therapist. So an OT helps patients improve their daily living or job skills. Write that down. Occupational therapist helps patients improve their daily living or job skills. So this job varies on the depending on the needs of the patient. So you might have kids that are delayed. They might have some kind of neurological issues going on, and they have to have a physical therapist to help them learn how to do things like brush their teeth, write and stuff like that. Also, you might have occupational therapists You might have somebody, even though they're adult, they had a stroke. Strokes affect certain parts of your brain. So you can have somebody had a stroke that affects a part that deals with, you know, brushing your hair or tying your shoes. So occupational therapist will be the person that's going to help you to get those skills back. You know,
stop at daily living or job skills.
yes. So, you know, physical therapists do work in the school setting. I know my daughter has had PT. She gets PT at school. She gets speech at school. She also gets OT. So these people can work in the school setting. Huh? Occupational therapist. And physical therapist, physical therapy, and speech therapy. They got a program at Tuskegee for occupational therapists. My little cousin is in that program, and you'll have a master's degree when you get done with the whole program. Huh? She thought she might be. She just likes to get on my nerves. Sit right there. Am I still writing?
Pharmacists dispense medications to patients. They provide information on dosage, side effects, and drug interactions to patients as well as doctors.
Did you diagnose? Yes.
No, I suggest medicine. I can't prescribe anything. So then you have your pharmacists. Pharmacists are those individuals that work in the pharmacies, like drugstores. They know everything there is to know about medicine. They know, you know, what medicines interact with each other. Because medicines have like a class. It all goes under like this one heading or whatever. So they know like the side effects. And a lot of times when you go to the pharmacist or pharmacy to get your prescription, they'll ask you if you want to talk to the pharmacist, if you got like, you know, if you want to ask questions. But they also give you that, huh? They weird. That's supposed to. If you have any, or a lot of times it's like if it's a new medicine, they'll say, "You got any questions?" I don't ever have questions because I just read the little, you know, they give you a little paper that come with it that tell you about the drug. I just read it. You throw it away. You better read it. Know what your possible side effects could be. Because some people can't take certain medicines. They'll have, you know, swelling or, you know, like pain or something like that.
Certified nurse assistants help patients in nursing homes or hospitals with basic care, such as feeding, dressing, or bathing.
So a CNA, that's what it is, certified nurse assistant. They can work in hospitals. They can also work like in people's homes or like nursing homes, stuff like that. It's kind of similar to a PCT. It's a certification program, so it's not a degree program.
Respiratory therapists help patients with breathing difficulties, from premature infants to end-of-life patients. They work mainly in hospitals.
So RTs, which is what I do, work in hospitals for the majority of everything. it depends on what it is if we work in other places, but we work mainly in hospitals.
Nurse midwives provide care to pregnant women and help deliver babies.
That wasn't this class. Somebody asked me about a midwife. Was it? Maybe that was.
What is the midwife?
They deliver babies. They deliver babies.
You know, my girl here tell my sister, my son, I'm gonna be so in your head and baby, I'm gonna be midwife.
Why they call them midwife?
I'm sure it's some story behind it. I don't really know.
A midwife?
So if you have a midwife, like, you don't really have to, cause some people like to deliver at home or, so it's probably those people before they start getting all this technology were the people that deliver the babies and stuff.
Sports medicine physicians help athletes with preventative care or treatment and rehabilitation for a sports injury. A sports doc may travel with a team, work for the military, or have a private practice.
So you have people that work, or doctors that work specifically in sports medicine, NFL, NBA, all those different fields. Also, they have, around here, because you got, students or athletes that get injured, that might have to go see they might call them like a team doctor, but that's what it is. Okay, I'm going to give y'all something.
I know they, but I was listening to something in my head. You know I'll be off here. You know I did not care. I'm making sure.
Everybody heard it. That ain't right. I didn't know what it was.
I told you, you know, it's small.
When you get a kid, I mean, it's like, they live like you like one kid. That's a lot of money. Spend on one kid.
It's like it's moving. And that's the thing that you play. When you're dancing, in front of me, when you ride. That's the only thing that you probably shows like
We're not dancing.
I just like it's
what's the best for that, baby? Because I don't want. Well, is this fine with me? I say this fine with you, fine.
yeah,
Take me there. Like I'm down for you. So you just said that you make that nigga wanna cry for you.
Oh my God. I just I thought you were
Take me bad, you like this?
You don't know how to act when you're not asleep. That's so crazy.
You gotta come and show me here.
I'm gonna read it.
Okay, you can read it right
Oh,
here.
give me the paper.
Who's that? I ain't gonna do my project. What you mean?
You got another problem.
We do special project. Okay, I get it.
Oh.
Yeah, I'll tell you all.
You run church.
Every year.
Y'all stay in the hallway together all day.
I know she enjoyed no. I know she enjoyed no check this 370.
I'm gonna tell her you said who I don't know what I'm talking about. I don't know how to work around.
With a 373 check. No, you do not. I said.
That ain't her check. Go ahead.
That is her check.
He said so far.
No, that's her check. Oh. But it's her pay that exactly.
Okay, so I don't think but I hope she's not doing no check for no 370 because that can hurt.
I remember last time I got 370.
I'm the last man in the group. Well, I say she's the lady. That's all I'm doing. Get that little rose from me. Oh, you know how many people know this, so I'm just there for like, so I have
Oh my God, I want to go to the country.
but I think I need some people to work, so I'm
It's a regular policy.
It's okay, I'm going to that trail ride. I know she is.
Minimum since life. This one today. One college graduate.
I mean, 18.
That's the first time people go to school. Right?
No. Yes. Bro, I can't get over myself.
I'm very tired. Y'all keep talking
Huh? It's not getting
You got more than a little bit.
You say, what does this do? Tomorrow.
November 15th.
It do no.
I got 15 days. I'm not doing this.
I would do it. What's not?
What can you do for me? I could just do all of it. I can't even do it. I can't do I can't do it.
That's what we used to. I can name mine.
What program you gonna use? For what?
My computer not hooked up at home.
What about to do it? What project?
What's the
Your project.
We're not working on it today.
I know, I'm just saying.
Why we keep ready?
Can you start doing it?
We're gonna turn it in a date.
That's old.
I said, what if though?
What's the library? It's representation.
Library.
Oh yeah, that's what I'm passing out.
Hey, say you right.
I can't find nothing.
You can Chromebook up Come here.
Can you give one?
Here.
Alright, y'all need to listen. Cause y'all asked 75 questions, and it's probably gonna be something I've already said. Yes. Cause you know somebody gonna ask me a question I already said. No, I'm saying somebody gonna ask me, and I already said it.
What's up?
Oh, I hope you know that don't work. That's why they over there.
What? I'm on different people.
You know what I did? Them old, them my old ones. Hold a minute. Okay. Alright, so this is the paper I gave y'all, the one that has like all the words on it. These are your directions. Huh?
You gave us that paper, so no, because then we talked about how you gave us that paper because you got a project.
Oh yeah.
You saw the lame like.
Alright, you need to pay attention to them. It should be no talking. You need to pay attention. Read a turn away. Read a turn away.
Put him on book.
He does. Where your papers at?
You know who's
Book bag.
You already have stuff you need to be writing down on the paper. Where you put the paper?
Oh.
You know who's
Somebody. Oh, you talking about like somebody I go to.
So when you was doing like that, you was doing
Alright. Okay, everybody look this way. Okay, hello. Alright, this way. Alright, so I gave you these sheets of paper because you're going to pick a career. It's only one per person, so we're not going to have like 15 nurses, okay? Yes, they do. Yes. So we're not going to have 15 of them. I'm going to send around, probably today, a roll, and y'all going to write what y'all pick. So circle a couple of them just in case it's taken. And you're going to write what your choice is, beside your name, so I'll know who got what. And make sure we don't duplicate. Alright, so you will have picked a career in healthcare. So you will be researching that particular career and will make a Google Slides presentation and present. It's in bold and capital letters. It during class. Use a rubric that is provided for you. So this is your rubric. Because I'm thinking people don't really understand what rubrics are. If you look at their rubric and you do everything that's in the rubric, you're going to get the most possible points. Okay? That's a rubric. So use it because that's how you will be graded. If it is a presentation, that means it should be presented. It's not just turning it in and that's it. Who? There is a minimum of 10 slides, so a minimum of 10, not including the title slide. So the slide with your name on it or whatever, your name of your career.
So basically
11. No, y'all do the bare minimum, so 11. Alright. So there is a space for the link on the rubric. So at the bottom, it says presentation link. It says Google Slide link. And I'll show y'all how to, if you don't know how to do it on Google Slides, I'll show you how to do it because you got to make sure that it is sent to MPS. Otherwise, it's going to be private to you, and I can't view it. All right, so it's not going to be November 15th. That's going to be an even day. It's going to be November 16th. So y'all can put November 16th on your paper. That's for my even classes. So November 16th is for y'all. I had to go back and look at the days.
Ooh, what's a wellness club?
Somebody probably like plans out
So we can do it on any one of these?
Yes, but we're not duplicating.
What you mean?
It's only gonna be one person per whatever.
Okay, so what is it? Somebody might end up doing the same thing.
How I said, circle a couple of them. So, because I'm gonna send the list around, you gonna put what you want to circle on.
The Delta people that make like the dishes and stuff.
What those people call? I'm gonna have to look because I don't know if it.
I think it's a lab technician.
It might be. Well, I'm not even asking. I was saying. All right, so. Alright, so you must copy and paste the link from your Google Slide in that space and submit it by November 16th for y'all, before the start of your class period. So class starts 7:30. It needs to be submitted before 7:30. Okay? You're not going to be able to come in here but like, cannot? No, you cannot. You better have it done before you get in here. You.
Oh.
Alright, make sure that you proofread before submitting it. Y'all like to just put stuff on the slide and y'all stuff be red, underlined, stuff be spelled wrong. Y'all just turn it in. I will take out for spelling and plagiarism, punctuation, etc. So make sure you read. Don't just put stuff on the slide and turn it in. Read it, because it might not even make sense. That's why you need to read it to make sure that makes sense. Practice going through the slides before the day of presentation so that you're familiar with your information. Because I don't want you up here like, I've had people that be like, no. Yeah. I mean, you don't have to be like this the whole time. You can just, glance at it. You don't have to read it verbatim, word for word. You can glance at it, pick up a few words, as long as you're presenting, not just staring at the screen.
I start seeing life a lot.
You must also complete and turn in the career choice worksheet the day of your presentation. So it is on the back of the rubric. So this is kind of like what you're going to do your research with. So you're going to put your topic, like where you got your information, your job descriptions, working conditions. So this is just like a place for you to put like what kind of information you're going to put into your slides. All this stuff is on Schoology. So I just gave y'all copies because some of y'all like paper. But it is on Schoology for you to submit and turn, because that's the way I want it turned in. So when you turn it in, we can just pull it up and you can present. What? What? No, you gotta have words on them.
Man, I'm just so exhausted.
Alright, so this is what the presentation should include. Title page, so your name of the class, name of your class is Foundations of Health Science, your period, and the name of your career. So we've talked about job description and working conditions. So what do they do? What are their duties? So if you pick a paramedic, what you on list, what does a paramedic do? What kind of conditions do they work in? They're out, they respond to emergencies, those type of things. Career pathway. So we started talking about pathways today. We went over diagnostic and therapeutic. So, what pathway does it fall under? You got this sheet that should already give you what pathways are going to fall under. Required education and training. What type of degree? Associates, bachelor's, master's. Must you attain for this career? Also, some of them could be doctorates. Do you have to have any certifications, registrations, and/or licenses in the field? You're going to find community college, universities, trade schools in the state of Alabama that offer that major or certification. Okay? Shouldn't be hard. All right, so salary and wages, national for the whole United States and the state of Alabama. I've given you this website here that you can click on. All you got to do is put in, it's going to give you all this information. Put in whatever your career is. I got it already linked on there. It's written. Huh? Yeah. Because, y'all Google stuff that don't be accurate. So I gave you something that's going to give you all information. Some people do that. First thing that pop up, they write it down. What y'all do? That's what y'all do for them study guys. First thing that pop up.
If it's in bold, I'm right.
Alright, so job outlook. Is there a need for this career? Will there be a need in the future? Pictures. You should include pictures. People working in that particular field. Something. Make it creative and not boring. Alright, the last part. So you're going to create a pennant. Do y'all know what a pennant is? All y'all sports fans don't know what a pennant is?
No, I do.
What is it? A pennant is like those things that kind of shape like a triangle.
I think you.
Well, they don't know. So. A pennant.
A flag.
It's a pennant. It's called a pennant. So you gotta pick one of the colleges that you got in your education and training under that, and you're gonna make a pennant of whatever that college is. Okay. So you can use felt because they're like a felt material. I'm gonna try to see if I can find like a template so y'all can like trace it or whatever. You can use poster board. That's fine. But you gonna decorate it, and that's what that's gonna be your pennant for whatever school you chose. Okay.
We got a Google slide and like a poster
But not like it don't have to be no big poster board. Just because it's not. Yeah, the pen is not big. Just enough that we can see what college. I'll have some examples of stuff that I'll link on Schoology somewhere. Okay. Y'all have any questions? So when is it due?
Tomorrow.
November 16th. By what time?
7:30.
I said some of y'all don't get here to 8. Make sure it's turned in. Huh?
11:59 p.m.
No, it's not 11:59 p.m.
Why?
Cause how you got? Oh, the day before I can make it 11:59 p.m.
No, I'm talking about on the 16th before it turns to the 17th.
It can't be if you present it on the 16th.
Okay.
But we ain't gonna get through presentation though.
So we can spend. I mean, that's a week of we get out for Thanksgiving. I'm not trying to do a whole lot anyway.
I'm going back.
I'm eating about 7-8 times today.
Huh?
What is that? Where am I wrong? Come on, Black History
Alright, so the plan is, listen up. The plan is, wait.
How you eating this thing?
Why?
It's over. It's over.
It ain't over. No. On what you? But then you don't know how yesterday. Oh no. Alright. Oh.
You hear where I'm headed to be housed on you? Oh, you gonna drag it
I don't like sugar.
I hate that play around it with the little one.
Where's my pour out of this story? Oh, that was brown. What color is it? So the plan is Thursday to have Chromebooks in here for y'all to work on. So let me pull this down so y'all can hear me. That doesn't mean y'all come in, y'all play. It means if I have Chromebooks in here for y'all to get some work done, that's what y'all need to do. Okay, talking, all this talking and everything else y'all like to do. And y'all should do great with the presentation part because y'all talk a lot.
Especially him.
Oh, yeah. I'm so weak.
All right, let me print and roll. You're gonna pick what your topic is today, your career, and I'm gonna send it around. You're gonna put beside your name what you're picking, okay?
Nobody better not pick. Nobody better not pick.
Well, listen.
Oh, I already got dental labs too.
Is that person picking?
You can't put it in my face. If I pick you first, you can't put me in. You can't erase nothing, baby. I'm right in pink. Oh, okay. You're gonna be strict. You ain't gonna see your head.
No. Yes, it is. Yes, it is. No, it's not.
I thought the 6 about
What?
when they pick her dog. If it's like that nigga broke, I believe you like. Got a big finger. He had a big finger. He gonna make it. I ain't gonna work up. You guys need to be working.
Where you working?
I need to be working. What I don't need y'all work on me. I need to be working.
I don't want to do this. You got some work to do with me. You got some work to do now. Yeah. How do you think you got some work to do? And anesthesiology. Okay.
Yeah.
Remember how my test was last time? Yeah. We have enough now. And I hope we don't make it. Only got
'Cause in.